Critical appraisal is the process of carefully and systematically examining research to judge its trustworthiness and its value and relevance in a particular context. By appraising articles critically, you'll be able to find the best evidence or highest quality studies to inform clinical practice or research. There are some general principles that underpin the evaluation of any research study. In this and the last video, we will examine 10 questions that you can ask when critically appraising research articles. They are based on a review conducted by Young and Solomon of literature on critical appraisal and internet-based critical appraisal tools and checklists. First, you should ask, what is the research question? Is it clearly defined? Look for statements that discuss the patient cohort and the type of intervention or therapy being studied. These are usually found in the methods section or at the end of the introduction. Consider whether the study's research question and patient cohort are relevant to your particular context. Do you have a similar local population, individual patient, or healthcare setting? You should then consider, why was the study performed, and does it add anything new to what was previously known? Statements along these lines are generally found in the article introduction or at the beginning of the methods section. The statement should be followed by an explanation of what is already known on the topic and a brief review of published literature to provide evidence to support the necessity of the study. Once you've determined the research question and why the research is needed, it is important to find out what type of question the study poses. Research questions generally fall into one of two distinct categories. They can be quantitative question types, which are about things we can measure directly, such as measuring the effectiveness of streptomycin in the treatment of pulmonary tuberculosis. These studies will use data collection methods that involve the use of numbers. Or they can be qualitative question types, which are about what people feel, think, understand, and believe. These types of questions are more difficult to measure in a direct way. They focus more on determining the quality of experiences, beliefs, and understandings. For example, what is it like living with hepatitis C? This video examines research questions and study designs that are mainly quantitative in nature. This is a list of the main types of quantitative questions that you will find in healthcare research. Questions can relate to the effectiveness of a treatment. They may ask whether one treatment, procedure, or service type is better than another in terms of clinical or cost effectiveness. Other questions relate to the incidence or prevalence of a disease or healthcare problem and how to reduce the risk of the disease or reduce side effects and risks associated with an intervention. This category includes questions about diagnosis, prognosis, or prediction of specific clinical outcomes and investigations on the quality of health care. You can find further descriptions of question types in the sources listed at the end of the third video. After determining the type of question the researchers are posing, consider if the authors have used the most appropriate study design to answer their question. For instance, a randomized controlled trial would be suitable for a question investigating the effectiveness of the drug streptomycin on pulmonary tuberculosis. However, this type of study would not provide the best evidence to establish the extent of serious eye disease and visual impairment in a North London population. A cross-sectional study using surveys to observe this population at a single point in time would be more suitable. Also consider, in some circumstances, a suitable study design may not be feasible or may not be appropriate due to ethical concerns. There are many different study designs. This table shows the study designs that best suit the different question types. In every case, the best evidence comes from studies where the methods used maximize the chance of eliminating bias. Bias is a systematic error in the way observations are made or the experiment is carried out. Bias can occur in studies in many different ways. It can arise, for example, from the way study participants are defined and selected, how data is collected, or through the researcher's analysis or interpretation. Another form of bias can occur when confounding factors have affected the outcome of the study. Confounding factors are patient features and other possible causal factors apart from the one that is being measured. Their existence can make it difficult to establish a clear causal link between treatment and outcome unless appropriate methods are used to adjust for the effect of the confounders. To address this, the study should ensure that groups are as closely matched as possible at the start of the study and that their management is similar in every respect, apart from the treatment or exposure of interest. During the analysis of study results, the association between any confounding factors and the outcome and exposure of interest should also be explored. The next step is a core part of the critical appraisal process. Did the study design and methodology address the key potential sources of bias? Key points to consider in the appraisal of each of the main study designs will now be provided. However, it is recommended that once you have identified the study design, you should also use one of the design-specific critical appraisal checklists and tools freely available on the Internet to guide you. These include a collection of appraisal sheets from the Center for Evidence-Based Medicine and checklists created by CASP, which stands for Critical Appraisal Skills Program. Links to these critical appraisal tools are available on the University of Queensland Library Guide, Evidence-Based Practice in Health Sciences. Firstly, systematic reviews and meta-analyses. A systematic review is a summary of medical literature on a particular topic that systematically locates, appraises, and synthesizes evidence contained in individual studies. Meta-analysis is a type of study that can be found within a systematic review. It uses a statistical method to pool data from several studies. Consider if the researchers did everything in their power to ensure their approach was as systematic as possible. Did they find all the best evidence? And did they take into account unpublished studies as well as published ones? Also consider if the selected articles were appraised and data extracted by 2 independent reviewers. Randomized controlled trials, or RCTs. During this type of study, participants are allocated into an experimental group or a control group using a random mechanism. This should ensure that treatment groups are equivalent in terms of both known and unknown confounding factors, so that any differences in outcomes between the groups can be ascribed to the effect of the treatment. When appraising RCTs, look for evidence that the process of treatment allocation is truly random. Would participants be able to guess their treatment allocation? Were both participants and researchers blinded to the treatment groups? Were all participants who were randomly allocated a treatment accounted for in the final analysis? Cohort studies involve the identification of 2 or more groups of patients, the cohorts, one of which has received the exposure of interest, such as a vaccine, medicine, or environmental toxin, and one of which hasn't. In a prospective study, the cohorts are identified at a point in time, such as time of birth, exposure to a particular risk factor, and followed in time to record health outcomes. In a retrospective study, the cohorts are defined at a point in time in the past, and information is collected on subsequent outcomes. Consider whether all confounding factors have been identified and how the groups have been selected. The groups need to be equal in age, gender mix, socioeconomic status, and have the same coexisting illness, with the only difference between them being their exposure to the agent that is being studied. Case control studies involve the identification of patients with an outcome of interest who are the cases, and the control patients who do not have the same outcome. Information is obtained about their past exposure to the factor under investigation. Consider the methods used in the selection of appropriate control individuals. Patients used as controls should be drawn from the same population as the cases, with the only difference being that they haven't developed the same outcome. Another factor to consider is the possibility of recall bias. where a patient's inaccurate recollection and interpretation of what caused their condition is relied upon. Determine if subjective study measures were used and if recall bias was likely. A cross-sectional study involves the observation of a defined population at a single point in time or time interval. Exposure and outcome are determined simultaneously. Examples include one-off surveys and audits of practice. Consider the methods used to collect the population sample and the size and makeup of the sample. Was the correct method used? Was the response rate sufficiently high? And were all relevant exposures, potential confounding factors and outcomes measured accurately? Case studies report on a single patient, and case series report on a series of patients. No control group is involved. They provide low-level evidence about therapeutic effectiveness, but potentially convey a large amount of information that could be lost in a clinical trial or survey. Consider whether the cases are a representative sample and similar to patients in your practice. Did the study accurately measure all relevant exposures, potential confounding factors, and outcomes? There are other study designs that haven't been covered in this video, such as economic evaluations and qualitative study designs. Online guidelines and assessment tools can assist you to critically appraise these study designs. Links to these critical appraisal tools are available on the University of Queensland Library Guide, Evidence-Based Practice in Health Sciences. The final video will examine further factors for consideration during the critical appraisal process, such as whether the study was performed in line with the original protocol, whether the statistical analysis was performed correctly, and whether the data justifies the conclusions.